Hi guys, it's Kenny from docpods and Ergonx, and today we're answering some questions on a really common topic that we get asked a lot about, and it's corns and calluses. Now this is one of the most basic skills we learn as a podiatrist, and it's actually the first week of clinical rotation that we do is how to remove corns and calluses. And one of the questions we commonly get asked is, why are corns and calluses so painful? So if you have a look at what causes a corn or callus, it's when we usually get pain over a bony prominence or somewhere over the tip of a toe or over a bony prominence or a lump or bump or something in the foot where there's extra pressure. The extra pressure causes the skin to thicken in a protective sort of mechanism. And this is a normal physiological process, so there's nothing wrong with this. But unfortunately, if we continue to hold the pressure over the tip of the toe, for example, the on-off cycling of the pressure causes the skin's outer layers to thicken and become hardened. And unfortunately, this causes hard skin, causes more pressure, which causes more hard skin, which causes more pressure, and it keeps going round and round in a cycle until we get a corn form. Now, a corn is particularly painful because when a corn develops, and I've drawn a little crude diagram here, if you have a look at the skin, so that's the skin, this is inside of your foot, and this is the outside of your foot. When a corn forms, we get this callus cap form, and that's usually the first thing to form. And then if we keep walking on that, it causes the actual corn or the core to form, and often these are shaped like an ice cream cone. So if we think of this like an ice cream cone, you can see standing on the outside pushes all the pressure down through this tip. So what we're going to do now, we'll go over and have a look at me removing a corn and just see, I'll walk you through it when we're removing the callus, when we're removing the core, and you'll be able to see a little bit more of the anatomy of the corn. Okay, so what you can see here is a small corn in the heel of a patient. So usually what this would be is the patient's heel striking, and for some reason, either it's a footwear issue or there's a bony lump or a little spur in the heel. It's causing more pressure in that location for some reason. So what we do is we remove the callus cap. Now this is what we were talking about before. We remove all the callus over the corn, and you can see now that we're getting this really quite dense little section right in the center of the heel. And that is actually the corn or the core of the corn. So now we're enucleating that. So we just cut very, very carefully around the edges so as to not to cut into the living tissue, because that will be painful. And we just want to cut right on that boundary of living and dead tissue. And what that means is we'll be able to get this out without any anesthetic, without any pain. And then you can see the corns come out there. And now what we're doing is just going around, and if we can scallop down those edges so they're not as straight up and down or jagged, it just makes it a lot more comfortable, and it's less likely for the corn to grow back as quickly. And the more of that we can actually get out, the longer it'll take to grow back and the less pressure there will be. So that's why we spend quite a bit of time on this one, removing all the rough edges and making it look nice and neat and tidy. And then once we've done that, we can actually see if there's any more of the core remaining in there. So we go back in, just make sure we've gotten all right down to the dermoepidermal junction. So there's absolutely no hard skin, no corn, and there's going to be less irritation for the patient. And the more we can clean and tidy that up, the more comfortable it is. Because the last thing we want to do is cause more pressure just to the side of where the corn was. And so that's what a corn that's been enucleated looks like. So that's it. That's how we remove a corn from the heel of a patient. It's a very basic skill that all podiatrists can do, and we learn this in about the first week of our clinical practice. The reason why we remove corns is because they can cause infection, and in certain patient groups such as diabetics and immunocompromised groups, they can cause amputations because we get an infection and it spreads, and usually a diabetic patient may not feel the infection spread, and then the foot will need to be removed to save the patient's life. So look after your feet, check your feet for corns and calluses, or if you've got loved ones that have got diabetes, please check their feet. And if you have any other questions or would like to see more corn and callus removal videos, please comment below and we'll do our best to make a video for you. If you enjoyed this video, please like and subscribe to our channel. It's very simple to do and it really does help us out. If you need further information on the topics discussed, please follow the links in the description, and that will take you to our website where we've got more information on these topics. If you have a specific question that you'd like to ask, please comment in the comments section below and we'll do our best to make a video to address your question. If you have any further comments or questions, you can find us at ergonx.com.au, and we look forward to seeing you in the next video.